it really is fascinating to watch. There's a new, relatively new concept called becoming a master adaptive learner. And it is an attempt to have a more integrated approach between undergraduate medical education and graduate medical education. So, for instance, are the things that we're teaching in the M3, M4 year in ophthalmology those things that program directors really expect people to have? And not just in ophthalmology, but professionalism, um, evidence-based interpretation of medical literature. What is it that program directors really want? And are we sure that we're delivering it? That's one aspect of it. But the other aspect of it is people really talk about what's required to achieve mastery. How many hours, um, deliberate repetition, all of the things that we know. But becoming a master adaptive learner is not just becoming a master of a craft, but having the ability to maintain that mastery over time. So you make it up the hill and you achieve mastery, and you don't do what's required to maintain that same mastery, but it's an adaptive mastery. Much to your point about how rapidly ophthalmology is changing, how do you train people to have those sort of metacognitive skills, to be able to self-correct, to analyze information, basically retrain themselves throughout the course of their medical careers. So
it sounds like you're discussing what does it mean to be a lifelong learner, which is a phrase that has been around for the longest time in medicine. But now we're really getting into what does it mean and what are the processes involved in that?
Right. Very right. And so even if you talk to an M1, they will almost by rote tell you, I am a lifelong learner, because it sounds like something you ought to say, right? Who would be against it?
Right.
But what does that really look like? How do you teach those skills to somebody? How do you assess them to know that they have those skills? And now the medical educators really, this is where the rubber meets the road. How do you teach that? How do you know students have that? And what is our role in making sure that we don't bog people down with things that are not conducive to developing those skills?